Thanks for staying with us. So amid COVID-19 issues, there are recent incidences of people slumping and eventually dying because of heart attacks. Many prominent people have made the headlines, and ordinary Nigerian citizens are not left out. As such, we want to understand exactly what is a heart attack and how can it be treated and prevented. Here to discuss this important issue is the Consultant Interventional Cardiologist and Medical Director of Euracare Multispecialist Hospital, Victoria Island, Lagos, Dr. Tosin Majekodunmi. Good morning, doctor. Are you there?
Yes, I'm here. Good morning. Can you hear me?
Yes, very clearly. I'm glad to have you on the show today. So, heart attacks. Yes, heart attacks. In recent times, we're hearing of people just slump and die immediately while jogging or just having a regular day. Could you tell us exactly what exactly is a heart attack? Let's start from the basics. What exactly is a heart attack, and how is it different from a cardiac arrest?
Well, this is a very timely topic. So, a heart attack is essentially is a layman's term. But what it really means is that the heart is basically a muscle, and it has its own blood supply. A heart attack is what we call what happens when part of that blood supply is temporarily blocked, so that a part of the heart is not getting enough blood. That is really what we call a heart attack. Now, you already talked about cardiac arrest. A heart attack can lead to a cardiac arrest, which is why a heart attack is such an emergency. Because if a part of the heart is not getting enough blood, that part of the heart can decide, the electrical activity in that part of the heart can become very abnormal, such that the heart now stops working, which now is a cardiac arrest, which is why when somebody has a heart attack, we have to intervene quickly so that we don't allow it to get to a point where there's a cardiac arrest.
What are those warning signs that you may see and think, oh, maybe I should get to the hospital before it gets to a heart attack or cardiac arrest?
The first thing I would say is that you need to have a number of things, what we call risk factors, that make it more likely that you're going to have a heart attack. So any of your listeners who happen to have hypertension, which is very common in our society, diabetes, high cholesterol, smoking, or even a family history of somebody at a relatively young age having a heart attack, those are people who should be on the lookout for thinking, if I have anything, I should be worried that I'm having a heart attack. Now, what are the things that they should be noticing that will make them think they're having a heart attack? This would be things, the classic thing is chest pain. So whenever anybody is having chest pain, the concern always has to be that, is this a risk or is this the manifestation of a heart attack? Sometimes people don't like to call it pain. They will say it's a discomfort. They can call it a burning. They can say it's not a pain, but it's a pressure in my chest. Any of those kind of symptoms always make us worry about the possibility of a heart attack.
Now, before I come to Sokwe, you said something earlier about graduating from a heart attack to cardiac arrest. How many seconds or how many minutes do we have between that? Because people always fear that once you have a heart attack, that's the end. Is there a possibility to save somebody's life before he gets to a heart attack? And how long do we have to get the person to the hospital?
Okay. Excellent question. So it varies. The truth of the answer is it varies. So some people, unfortunately, and we always put this at about 50%, or 50% of people that have a heart attack, we as doctors never even get an opportunity to intervene on them, because sadly, as you said in your introduction, they just slump and die on the spot. Yeah. Because the moment they have the first symptom of heart attack, be it chest pain, the heart goes into a crazy rhythm, they go immediately into cardiac arrest, and then they slump and they die, as we say. But for the other 50%, there is time to be able to do something. And this is why this topic is so important, because your listeners need to know that if they have chest pain, they feel any abnormal shortness of breath, they get palpitations that won't go away, and they feel very unwell, they must immediately take themselves to a hospital and get themselves assessed and very quickly know whether what they're having is something else or it's a heart attack. And if it's a heart attack, then there is a time frame for dealing with that heart attack before permanent damage occurs to the heart. If you intervene quickly, the damage is only temporary and the heart can pretty much go back to normal. Okay. But if you wait too long, then the heart attack, the damage becomes permanent and you can't reverse that damage no matter what you do.
I actually used to have palpitations and I used to have chest pain, like it's squeezing serious chest pain. I don't have hypertension. Yeah. I don't have high blood pressure. I've done extensive medical check, but occasionally it still comes up. So what can someone like me do in that situation? And what should I be worried whenever that comes up?
That's a fantastic question. So the answer to your question is you don't need to be worried. And the reason why is for exactly what you said. You are not hypertensive, you're not diabetic, you don't smoke, you're not in the right age group to have a heart attack. And there are many causes of shortness of breath. There are many causes of hypertension. The vast majority of those causes are not due to heart attacks. Only a minority of those patients will have a heart attack. So the main thing is to get yourself to a hospital where if you're having a heart attack, they can intervene and unblock that blood vessel within 90 minutes of them getting there. But the key message here is that anybody in the risk group who has any of these symptoms, they cannot take a chance. They need to go immediately to a hospital and get assessed.
Right.
And the minimum assessment that is required is that they must get an ECG. So they can't go to a hospital and someone tells them, oh, you have ulcer, take some tablets. That cannot work. They must have an ECG done. And somebody must look at that ECG and make sure that that ECG is not suspicious of a heart attack before anything else happens. That is a really crucial piece of information.
Thank you.
You can watch Your View on TVC every Monday to Friday, 9 a.m. to 10:30 a.m. Nigerian time on DSTV channel 418, GOTV channel 27 and channel 47, StarTimes channel 121 and channel 307, Play TV channel 801 and channel 190, UHF 49, Sky channel 515 for UK viewers. Watch live on Facebook at TVC Connect and on our website tvcentertainment.tv/livestream.